Swadikap. Good afternoon once again. Today is Wednesday, the 17th of March 2021, and this is the English language summary of the Center for COVID Situation Administration, or CCSA, as always. So firstly, it's just to inform you that this morning we had a meeting regarding the proposed relaxation of measures for the Songkran Festival, which will be coming soon, next month. And there are various proposals for that, and I'll brief that to you in a short while. Now, first of all, just to start with the numbers that we have for today, and we'll have a slide coming up for you. The key number that you will see on screen is 975, which is the number of people who are currently being treated in Thailand. You may notice that this number is getting slightly higher, and I'll come to that soon, because we have a new confirmed case, which is 248. If you notice, in the past days, we had around 50-ish, lower than 100 per day. But today we have 248 with 40 new recoveries. Out of the 248, 163 cases are from active case finding. So just to recap on the Songkran proposal, so these proposals that I'll be mentioning will be finalized on Friday. The discussion for the proposal was today, but we'll finalize this on Friday during the general CCSA meeting, wherein the Prime Minister will be chairing the meeting. Now, among the proposals include the no water splashing during Songkran, as well as asking for blessings from the elderly as part of Thai tradition during Songkran instead. And the key words in Thai for this is rin rot prom. So basically, pour or sprinkle water on the hands of the elderly, wearing masks, and avoid water splashing, and focusing on the traditional custom of Songkran that Thai people know very well, Rin Rot Prom. The Prime Minister had also previously asked for the cooperation of the people during Songkran to follow the strict disease control measures, including area control in terms of entrance and exits, mask wearing, and keeping checkup, and of course using the Thai Chana application. So in detail, these measures will be finalized on Friday and announced in due course. Now, just to mention that in the relevant provinces that we are talking about in terms of the cluster that we have in Samut Sakhon that we had, and the district of Bang Khae in Bangkok, which there had been some cases found positive from that area. The relevant agencies are looking deeper into these various markets, fresh markets, to see how effectively the DMHTT measures are being practiced in those areas, as well as in reviewing the various practices under the Bangkok Metropolitan Administration, in which these fresh markets in Bang Khae are under the jurisdiction of the Bangkok Metropolitan Administration. Now, in terms of the Bang Khae district, there had been, in effect, some other provinces which had been actually affected by the Bang Khae district cluster. A few positive cases in certain provinces. One particular province is Si Sa Ket, wherein actually it was the first time that a positive case was recorded in Si Sa Ket. So Si Sa Ket is no longer in the list of provinces with 0 positive cases. There had been one positive case in Si Sa Ket, and that one case is actually from the cluster of Bang Khae, meaning that a vendor from Bang Khae went home to his or her domicile, his or her province in Si Sa Ket, and tested positive. Therefore, Si Sa Ket was counted as being a province now with COVID infection. But nevertheless, in Bang Khae district, the reason that the numbers are increasing in that district in Bangkok is actually because of the commencement of active case finding missions in Bang Khae district. Now, so far, around 6,000 plus people have been tested in that area in Bangkok through the swab test or the pool saliva test, and the active case finding will continue in Bang Khae district and all these markets. So expect to see the number of positive cases in the days ahead be increased slightly from the last week. But rest assured that they are from the active case finding, and the faster that we are able to root out the positive cases in Bang Khae district, and we'll put the positive cases, of course, into the medical care system. So the faster we find them, the better. And just expect to see the numbers increase in due course in the few days. But in a good way, in a way that we are in control, we are able to control and identify all those people who are positive in the area. Now, talking about Bang Khae district a little further, with the active case finding that we have in Bang Khae district in Bangkok, there had been the grant by His Majesty the King of 4 biosafety vehicles to the public health officials for the COVID tests in that district, in Bang Khae district. After asymptomatic cases were reported among visitors to some of the markets in the area, and you have an image there of the royally granted equipment, vehicles. The governor of Bangkok had also said that people who have visited the markets in Bang Khae, namely Siri Sethanon Bang Khae Shopping Center, Kiti Market, Pasom Market, Bang Khae New Market, and Wonder Market, from the dates of the 20th of February until the 16th of March, should undergo testing at the mobile unit, which will be stationed at a public park near a department store called the Mall Bang Khae. Yes, so another related issue is, as Dr. Apisamai had summarized just now, is that about the vaccination, the Prime Minister yesterday and 15 ministers of the cabinet received the COVID vaccine already, AstraZeneca, here at the Santi Maitri building at the Government House, where we are right now, in this complex, before the cabinet meeting that they had yesterday on Tuesday. This was broadcast live on Facebook of the Thai government spokesman, reassuring the public of the vaccine's safety and effectiveness. The Department of Medical Sciences and the Food and Drug Administration, as well as the Disease Control Department, had been evaluating this data related to the case and determined that the vaccine is safe for use in line with the World Health Organization's clarification that no evidence suggests AstraZeneca's vaccine do actually cause blood clot. Now, talking about vaccines, just a little bit on the vaccine distribution plan update in Thailand. So since the 28th of February, when we received the first batch of vaccines, until today, we have tallied 53,842 total inoculations in Thailand already, 53,000, and the number of vaccinations would continue to rise as we go forward with the vaccination plan in Thailand as set out earlier. Just one additional piece of information which may be useful to the English language audience, that on Thailand's COVID rapid response test kits, what we call the COXI AMP. So the Food and Drug Administration, FDA of Thailand, has recently certified a COVID-19 rapid response test kit named COXI AMP, which can show a test result in just 75 minutes, with the cost each test kit estimated at 300 baht, which is faster and less expensive than the RT-PCR technique. This test kit was jointly developed by the Biotech Center of the NSTDA and the Faculty of Tropical Medicine of Mahidol University. And the actual tests on 146 sample specimens during using these kits show that they have a 92% sensitivity, 100% specificity, and 97% accuracy without the need for further expert analysis. And many Thai companies have shown interest in these COXI AMP test kits, with an aim to acquire technology transfer to mass produce them at an industrial level in the near future. So this is news about continuous innovation in Thailand regarding testing. So just in closing, there may have been a lot of graphs and information that you saw in the Thai language edition. Some of the graphs in some parts, for example in Bangkok, may have looked a bit steep, but nevertheless we will still continue to seek for a controllable situation with the active case finding, particularly in Bangkok, although the numbers that you see might get a little bit steeper. So as there are more active cases arising from the markets in the Bang Khae district that I mentioned, we'd like to just advise to not forget DMH TT wherever you go for groceries, for shoppings, to prevent disease transmission, and practicing these measures particularly during peak hours, and perhaps limit outdoor shopping hours as necessary, and make shopping lists, of course, to reduce your time when you go to supermarkets or markets. And there's an infographic related to that that was shown to you just now. So thank you very much for your attention, and we'll see you again on Friday. On Friday, we'll be having the general CCSA meeting with a lot of information that will be released, a lot of decisions and measures that will be finalized by the Prime Minister, who is the director of the CCSA. So looking forward to report that to you in detail on Friday again. Thank you. Have a great weekend. สวัสดีครับ
กราบขอบพระคุณค่ะท่าน